About 3 million American men are living with prostate cancer, and most men over the age of 70 have some form of prostate cancer, according to the Prostate Cancer Foundation.
But there is still a lot of debate about when younger men should start getting their PSA levels checked. The Fox Medical Team's Beth Galvin is here now with one man's story. Beth?
And Tom and Deidre, there's a lot of debate in general about getting PSA screening tests. Most experts say that men should talk to their doctors about when to start getting a PSA test. And that's what Karl Lutz did at 49. And boy, is he glad he did. Prepping the equipment to coach his son's Pee Wee football team, 51-year-old Karl Lutz of Peachtree City says the story of how he discovered he might be at risk of prostate cancer begins with a blood test he never set out to get.
Because I had absolutely no symptoms. Zero symptoms.
Lutz, who is married with 2 children, went in for a checkup 2 years ago at 49. He was concerned about his family's history of heart disease, but getting a blood test to measure his PSA, or prostate-specific antigen level, wasn't even on his radar screen.
The only reason I got mine checked was because I happened to be in the doctor's office and he mentioned it and encouraged me right there on the spot to go ahead and do it.
So Lutz did. He got his PSA, or prostate-specific antigen level, checked.
PSA is just a blood test, and it's a protein that all men have that have a prostate at a certain level.
And Northside Hospital urologist Dr. Scott Miller, who works with the organization PROSTAWARE, says many things can elevate a man's PSA level, like getting older or having an enlarged prostate gland or even an infection. So Dr. Miller cautions an elevated PSA does not mean a man has cancer. But 2 main risk factors are being African American and having a family history of prostate cancer. And because most men don't know their family's medical history, Dr. Miller recommends a baseline PSA check for men in their 40s.
If it's far below the level of 1, then that patient has a very low likelihood of developing prostate cancer sometime in the next 10 years. Whereas if it's, if they're in the mid-40s and their PSA is in the, approaching 2, that patient needs to be followed closely.
Lutz's first PSA level was high, over 4, so they repeated the test several times.
And it had jumped up to above 5. And at that point, I decided it was time to get a biopsy done.
And because half of Karl Lutz's tissue samples were positive for prostate cancer, an imaging test showed that the cancer was right on the edge of his gland. In February, he underwent robot-assisted surgery with Dr. Miller to remove his prostate gland.
I read all these horror stories about the side effects, which I know they're there because people experience them. But I'm going to tell you something, after 6-7 weeks, no side effects whatsoever. Everything works correctly.
And Karl Lutz says his life is once again back on track. And Medicare and most health insurance plans will cover a yearly PSA test for men 50 and older. Dr. Miller says it's really important just to talk to your doctor about when to start getting screened, because the answer really is going to depend on each individual man and their risk factors.
So it's really starting that line of communication, just putting it out there and seeing what your doctor says.
Yes, because I think most experts agree that we can't just across the board give all healthy men this test, because it gets a lot of mixed results and it can cause a lot of confusion and unnecessary procedures. So it's really about you and your risk factors as a man.
Yeah, being proactive with your doctor.
Yes.
All right, Beth, thanks.